and welcome to the Business of Data podcast. I'm your host, Catherine King, and it's a pleasure to have you join us today. In this series, we'll be speaking to senior data analytics leaders to share their experiences, challenges, and insights. Let's go ahead and dive straight into today's episode. Hello, everyone, and welcome to this episode of the Business of Data podcast. This week, we're going to be diving into the depths of data reporting and data literacy. With me today, we have the wonderful Tim Carey, who's the Director of Data and Performance Analytics from Bane Care Management. Smiling away there already. We're going to have a great conversation. Now, within data reporting and data literacy, we're going to be zeroing in on how COVID-19 has been affecting the demand for accurate data reporting and data literacy, and how the wider implications have impacted the healthcare industry and what Tim and his peers have been doing about it. So before we dive into this conversation, just a few quick facts on Tim himself. So Tim's been the Director of Data and Performance Analytics since 2018, and Bane Care Management operates 12 skilled nursing facilities, 3 adult day health centres and 2 assisted living facilities in Massachusetts. Tim leads the development and implementation of data integrity, advanced analytics, data visualization, reporting streams for Bane Care. That's quite a lot in one job role. These are required to support both the internal performance improvements and external partner relationships with hospitals, accountable care organisations and managed care organisations. He deeply cares about helping all levels of staff use data and analytics to continuously improve patient experience and quality care. Hello and welcome, Tim.
Thank you. Hello.
How are you doing today?
Excellent. Excellent.
Fantastic. Well, thank you so much. It's brilliant to have you on today. As is with the theme of all of our episodes, I ask a nice nosy question first because it's just the person I am. I see from your out of offices when we were talking earlier that you had some vacation time recently with the family. How was that? How's time been in lockdown and in COVID with your boys?
Excellent. Best as it can be. So we just got back. We went to Martha's Vineyard. It's an island off of Massachusetts. Beautiful. Actually felt safer there than I do in my own hometown. With compliance of people wearing masks. Vast majority of people in Martha's Vineyard, and especially in Edgartown where we were definitely compliant with wearing a mask. And now I come home and I'm like, we live in a nice town, but still see a lot of people that are not following the common sense rules. But hey, it
is interesting.
But it was beautiful to get away to work. The kids loved it. We kayaked, went to the beach, went hiking. It was just beautiful.
Oh, fantastic. It's so great to hear that they haven't missed out through what is quite a strange time, especially for children, I think. What's going on. I think it's strange enough for us, let alone them. And another question I wanted to ask you is I'm really keen on building my LinkedIn network. I spend a lot of time on LinkedIn. And when I was last looking at your profile to prep for this episode today, what really struck me was your headline title. And I'm going to look down at my notes here. Your headline title was Dad, Husband and Kind Person. And that really stood out to me because usually it's Chief Data or whatever the title is of the person kind of leads, but you lead with that. What's that about? How come you chose to do that?
Simple. It's a little way to really connect with a lot of people in a very simple way. So everyone has a title, right? Work title. But putting in, dad, husband, kind person. Now it's like, hey, I'm a dad or I'm a wife. I'm a spouse. I'm a kind person. I treat people equally, no matter what they believe in or what they look like or anything like that. So it's just a really, really simple way to connect with a lot of different people and show like, hey, this is who I am. Like I work really hard at work, but when I go home, or really now that we're working remotely, like when I go upstairs, I'm playing with the boys, trying to help out at home. My wife probably would want me to do it a million times better than I'm doing now, but always looking to improve. But I think it's important to have that.
I suppose it almost sets the tone for yourself as a person, and then also the content that you share on the platform as well. So it's not just, necessarily from your roles point of view, but also who you are as a person. I think that's fantastic. So let's dive into today's topic. Really, really
Okay.
exciting one. I mean, so much has changed over the last few months, which I feel like I have on repeat at the moment, which is just
Yeah.
a crazy time. So set the scene for me then, Tim. Pre-COVID-19, which seems like a million years ago now.
It does. It does.
What were your priorities? What was kind of your main data mission before COVID-19 came along?
So pre-COVID, man, the work that we were doing, with not just internal data with our own organization, but meeting with hospital health systems, large ACO physician groups. We used to have monthly meetings with some ACOs going over process improvement efforts that we could collaborate with those hospitals and say, look, when you send your patients to our facilities, here's the work and that's going on to improve the patient experience. Here's the work that we're doing collaboratively, if that's a word, sorry, I've messed that up, to have a joint effort on improving that quality of care for that same patient. So that transition to the next care setting is as smooth as possible. Now, since COVID-19 came around, all of that stopped. We're still doing things remotely, but that in-person meeting no longer exists. Like, we were reviewing every single hospital readmission with the hospital clinical staff in person. So we would have our team from the SNF saying, here's our point of view for a readmission. And then you have the hospital staff and physician group saying, here's our view of the readmission and what occurred. And now we work together to say, what broke down from this side to this side that we can learn from, and put processes in place and action plans in place so it doesn't happen again. For example, like sending a patient to a dialysis center, and the dialysis center, something changes, condition changes, and the dialysis center just sends the patient immediately to the emergency room. Well, why can't you call the skilled nursing facility, and maybe that work can be done at the skilled nursing facility versus sending to the hospital? Because we all know that once you send them to a hospital, the hospitals are overwhelmed, and the physician, doing the best work that they can do in the time frame that they have, end up admitting the patient more times than not. Yeah. So to reduce a hospital readmission, don't send them to the hospital, and they're less likely to be readmitted. Yeah. So all that work, it's not happening in that in person like we were doing before. Now everyone's working on infection control and policies in place with the federal government and the state level government. So things have definitely changed.
So I'm trying not to smile, but it's so funny that you're talking about how pressed hospitals were pre-COVID, and you can only imagine the increase in work and demand as well that they're now experiencing. So I can imagine that work for you has doubled as well. So is it a case that your kind of data priorities have now shifted to kind of dealing with more pressing issues that are currently in place over the next few months then?
Yeah. So right now, a lot of it is, getting the PPE. That's still a struggle. We're 6 months into this, and still coming up with PPE shortages, which everyone is banging their head like, shouldn't we have this under control by now? But unfortunately, it's the state that, America is in. Clinical staff, we're doing a lot of different things. The clinical staff have a lot on their plates with reporting to the state level and the federal level on COVID-19. And unfortunately, the federal level and the state level aren't apples to apples. So now you have a lot of reporting that goes to the state agency. And then you almost have to do basically duplicate work because it's not standardized to be apples to apples. So then you have to send more data and more information, more metrics to the federal government. And it's like, wouldn't it be wonderful if federal agencies and state level agencies, had some sort of communication and standardization that one was feeding the other, instead of having these individual SNFs and hospitals have to do duplicate work just to, get their data in the hands of the federal government or state level. And, hopefully we move to that direction, but current state, that's not really happening.
Absolutely. Well, let's move straight into kind of the main bulk of this conversation then. So you touched on there that obviously there's been a huge increase in reporting. I mean, we can see it now on the news. There's constant updating of figures and hospital numbers and beds and deaths and things like that. So it's very obvious to even the layperson that the data increase is definitely there. And as you touched on there, the state and federal level data require different things, different ways of doing it. So let's break this issue down. So how is your team working to meet this challenge? Who is it impacting the most? And is it the physicians and clinicians themselves who are having to duplicate this data, or is it coming to you to then kind of process in two ways?
So it's a joint effort. At first, kind of the thought was everyone send it to me and I can do it. But then you start, lifting the hood up and you're like, well, there's a lot of metrics in here that like I can help make things probably a little easier for data collection, but the questions that are being asked, it really needs to be answered at the facility level.
Right.
Like I don't know your PPE supply. That would you'd have to kind of have that at the facility level. Someone's in wherever their storage closet or storage room is, someone needs to be checking that on a daily basis saying, yesterday we used X number of N95 masks or X number of gowns.
Right.
Like me working at my house, I don't know that.
Yeah.
So, and then staffing, did you have the right staffing or what, and then there's just, the metrics that are being asked, I can help, but a lot of it does fall on the hands of the clinical and business office at the facility.
Now, is there anything comparable to this sort of thing that you've had to have before? So things like knowledge of PPE, staffing. Is there infrastructure set up to answer those questions that you can kind of translate processes and policies across, or is this just brand new and it's a case that this sort of thing has to be collected now and it's going to have to be created for this time? Yeah,
I mean, definitely, we were collecting data on staffing. But it's all new because the questions are, how many residents are, tested for COVID or positive for COVID or negative, obviously before COVID, we weren't doing that. So there's new things. I mean, it's not rocket science, but it is new to the clinical teams. And it's, it's all in Excel data files. So clinical people are excellent clinical, a vast majority of them know their clinical work better than anyone. But then you throw, Excel at them and sometimes you get deer in headlights. Some people are amazing at it and know it better than probably me, but there's an awful lot, the data literacy in the clinical stat, the nurses, bedside nurses for 10, 15, 20 years, and now they're in a leadership position. And, it's like, whoa, I have to do all this reporting. I was never taught this in, nursing school or medical school or clinical school or whatever program you were in. Even if it was taught, it was really easy, basic things that don't really apply to like the real world where data's messy and you have to scrub and clean and just to make sense of it all. Yeah.
Absolutely. I was chatting to a senior data scientist from Halliburton recently, and they were saying that actually they're going across to the universities to teach data scientists how to kind of work with a different type of data, but then also going over to kind of business users in different lines of the university to then teach them about data science, because it's about crossing that bridge like
Exactly.
You touched on brilliantly there. You've got clinicians who completely understand their own role, but maybe that data literacy isn't as high. But then also I can imagine there's a fair amount of data that comes across to data scientists that the career level knowledge of some of the data there isn't going to be as matched as possible. So how have you dealt with it? How have you, had to almost run around and put band-aids on these huge issues, because you've got to work fast. I mean, this situation is constantly evolving. So how have you been elevating data literacy to the point where, you can get this reporting done?
Yeah. So, I mean, at our level at Bane, our motto is, really like, keep it simple. Have the data in a graph that's visually easy to look at and quickly comprehend. So within, 3 to 5 seconds, you know exactly what that graph is telling you, and what to be looking for. And, is something good happening or not? And, we, really keep it simple, push it as frequent as possible so that they're constantly seeing what metrics are important in their line of work and how that trickles into our, top, main goals. So if it's something like patient experience and you're a dietitian delivering food, well, if for that staff member, their importance is that interaction with the patient and making sure that what they're delivering to the patient is what the patient ordered. So, you come across, I remember when my wife was at a hospital, delivering our sons, you order French toast and pancakes show up. So it's like, well, why did that happen? Well, that happened, that happens in hospitals, nursing homes. It happens everywhere, restaurants. But if it keeps happening, like I always say to the dietary aide, like if you went to a restaurant and you went there 4 times and 4 times you got the wrong meal, would you go back to that restaurant? Probably not. So why are you doing the same exact thing to the patients and the residents with their food orders? So like, why do mistakes happen like that? I mean, you just keep asking the 5 whys, and you dig into what's going on, but you deliver the metrics and the process improvement efforts to their level so that they can see like, okay, this is the metric that food delivery accuracy. Now I know I'm like 80%. Now I'm trying to get to 95 or 100% accuracy. I can see that my journey is working towards that, goal that we're trying to achieve. Does that make sense?
Yeah, makes perfect sense.
Okay.
And I love it, the idea of keeping it simple. I think when we talk data, often people want to do crazy visualizations. They want to run complex models because, the data nerds in us all, that's what we want to do. But actually, when we're talking about speed, which essentially this is what we're talking about, we need to get that data, we need to deliver it quickly because, it has very real impacts. Keeping it simple is definitely a place that we sometimes need to go back and revisit. So before we kind of move off of this topic, what's the response to this been for you? What have you kind of heard from the ground? Because we mentioned earlier, pre-COVID, hospitals were really busy. During COVID, hospitals are even busier. So what's it been like to then ask for additional data reporting? Has there been pushback, especially if those people aren't as data literate as, so it's not just a case of adding on an extra task, it's also learning how to do that task on top of it.
Yeah, I think this is the right time to be asking the right questions to those groups, saying, look, pre-COVID-19, we were sending huge data dump files with tons of metrics. Is 95% of that even being used?
Yeah.
I don't know. And if the answer is no, then why are we doing that? Like, let's just focus on what's going to be used and actionable, and all the other fluff. Let's tone it down a bit. Like you're asking for 1 million different things, but you're only acting on 3 of them. Let's work on the 3, and then when we knock those out of the park, let's work on the next 3.
Yeah.
Instead of just trying to gobble up everything and doing everything kind of half-assed. Excuse my language.
No, I love it. Keep it simple, back to basics. That's a real great takeaway from this. So let's move the conversation forward to kind of almost more of a macro level. How far would you say the healthcare industry has come over the past few years in respect to data analytics maturity? So looking at it from a macro view, where's its position in maturity?
I think in pockets, it's definitely moving in the right direction. Let's give that the positive spin. I think there's a lot of work to be done in healthcare. You look at other industries, I feel like they're light years ahead. I also, healthcare data is extremely, extremely messy. Just yesterday, I was playing around with some data from CDC and from the state level on deaths. And on the death certificate, there were like hundreds of different ways to say COVID-19. Just the spelling alone, and just so many variables that, like, shouldn't by now, and we've been in this since March, shouldn't we have, like, look, if someone's dying of COVID-19, it's a standardized way of saying COVID-19 on the death certificate. That's still not seen as a standardized process. So I think there's still a lot of messy data that needs to be cleaned up. So you can have all the, the bells and whistles with all these fancy dashboards, and they look lovely, but look under the hood. Is the data really accurate or not?
Yeah. So you've mentioned that word several times now, of standardization, both in reporting, in data, in how we do these things. What's the main barriers in place for getting to that level of standardization?
I think importance of having drop downs in fields, EMRs, other platforms that you're utilizing where there's data entry. If you have free text, it becomes the wild west. People are going to write everything. I mean, you could say, just in the city of Boston, there's probably 50 ways to say Boston, different locations, misspellings. So if you had a drop down and it was Boston, then you're standardizing that answer. So I think, it's a no-brainer, but we still see it. There's still fields that are free text, and it becomes messy. And just like the death certificate, that's probably a free text field, and that's why we have 1,000 different ways to say COVID-19.
Yeah, which just makes analytics great fun when you've got 50 things that all essentially mean the same thing. Yeah, absolutely. So going back slightly, then, you say that the healthcare industry is a bit of a mixed bag in terms of its maturity. In your opinion, what does it take for the healthcare industry to fully take advantage of the new technologies that are emerging, advanced analytics, AI, and all of those fun things? What has it got to get in line before it does those sorts of things?
I think it's got to be a lot easier for people to comprehend, and it needs to trickle down to the people closest to the work. So there are some healthcare organizations that, probably known throughout the world for having excellent analytics.
Yeah.
But then you go down to a hospital level, you go into the med-surg unit, and you go and talk to that nurse manager or nurse supervisor and ask him or her what they're doing for reporting, and they're going to bang their head into a wall and say, I can't get the data that I need and the metrics that I need to do my job where I need to be doing my job. But you go to the corporate office, and they got this big, giant, fancy office, and there's a million different, data scientists running all these reporting dashboards, but that doesn't always trickle down to the nurse manager, the nurse supervisor, right, the director of nursing, or physician at the unit level. And I think until it gets to that level, we have a lot of work to do.
Brilliant. Now, since March, many things will have changed for you in terms of, you've said it yourself, what different data missions you're now on. What have the past few months taught you about the state of data analytics within Bane Care? Is it a positive thing? Is it a negative thing? Are we still a way to go? What's it taught you?
Yeah, I think it's been, I think all of us are learning throughout this journey. I think the data literacy has definitely escalated and has moved up, because it's forcing, the clinical leaders, the facility leadership teams to really have a strong understanding of the data that, they're submitting, what's being asked. We've come across mistakes, and we've had to, correct data entries into different systems.
Yeah. And
I think it's a learning curve. So like when one facility, learns something or, makes a mistake, we all learn from that. And we share that with our facilities and, other people that we work closely with.
Absolutely. Fantastic. Okay. I'm looking at my clock in front of me, and I know we need to move towards the end of our conversation here. So looking forward then, I hate asking futuristic questions in such an uncertain time, but what are you hoping to achieve over the next 12 months? Are there any kind of things you want to tick off over the next 12-month period?
Yeah, I mean, I'd really love to see EMRs and other, third-party vendors really beef up their analytics so it becomes easier for the end user. What I'm seeing now in our, EMRs that we use, we still have reports that we run, and it only generates to a PDF, and we're in the year 2020, and it's like, come on, like, at the very least, at least export it to Excel, a CSV file, so you can, slice and dice it and play with it. A PDF, is really old way of doing reporting, but it still exists in today. I think I would love to see the analytics really improve. You see a lot of vendors, they push out a platform, but they push it out way too early before it's actually been, ready for prime time. I always say it's like having a kid and kicking them into the real world when they're 6 years old versus 26. Like, I know the sales team want to make money, but you're pushing a product out way, way before it's ready and before it's actually been, ironed out. And it just creates headaches for those that, think that they're buying a good product, and you get it and you're like, this isn't doing what we thought it was going to do. And now we're paying X dollars per month, and it's just money down the drain.
What would you advise people to look out for to prevent falling into that trap where you do end up purchasing or you end up with a service that you don't realize is immature?
Yeah, I always ask, give me a list of your customers that are using this, and I want to have a deep conversation with them. What are the headaches, bumps, and bruises that they've come across? Right. One, so I don't make the same, or we don't make the same mistake. And two, if they're hearing like, hey, I've been going to this vendor and I've been telling them ways to improve it, and it's been 12, 18 months and nothing has been changed, that's not a product I want to, have that conversation will probably end right then and there. They say, if you're not listening to those customers, what makes you think you're going to listen to me?
Yeah. So word of mouth still as powerful as ever then. Absolutely. Mm-hmm. Brilliant. So thinking about this podcast and what we've covered today, I mean, we've covered so much in such a short space of time. So when it comes to data reporting and data literacy, what is the top thing you want our audience to take away from this podcast?
I love the BI, the AI, dashboards and all that work, machine learning. I think it's 100% needed. I think a lot of organizations need to focus their efforts on the simple things, doing things easier for that frontline staff. I always bring it down to, if all levels of staff don't comprehend what you're doing, there's a lot of room right there. There's a lot of room for improvement. Yeah. And it needs to be simple and trickle down to that end user, that frontline staff, so that he or she can do their job more efficiently and use that data to be a data-driven organization. You want them to be data-driven, and it has to be simple for them to do that. Brilliant.
And then for yourself, if you could go back, say 5 years, and give yourself a piece of advice, what would that be?
So I was thinking about that question. It's a tough one. 5 years ago, I was at a different organization. I loved where I worked. I loved a lot of people I worked with. There were some, high-level leadership that, maybe not really agreed with all the things that they were doing. So I would say, I'm looking at, in America with Dr. Fauci and how he's always standing true to what he believes in, and regardless of, what the White House or the president is, disregarding what he's talking about. It's always, so my advice to myself 5 years ago would be true, always be true to yourself. Mm-hmm. What you believe in, stick with that, regardless of what a senior VP or a CEO has on their agenda, and maybe wants you to do something that you don't think is the right thing to do. Stick up for that and say, you know what, if that's not something you're comfortable with doing, look somewhere else. Go to an organization that you truly believe in, and stay true to yourself. I guess that would be my main thing.
And what a brilliant message to end this podcast episode on. Tim, thank you so much. It's been an absolute pleasure talking with you today. As always, thank you so much for joining us.
Thank you. Have a wonderful day and stay safe.
What a fantastic conversation. For me personally, I absolutely love when I get to chat to healthcare industry workers, because it just really highlights the importance of data analytics and the work that they do, especially when it comes to talking about data reporting and COVID, because the demand for it right now is so very high. As always, make sure you are subscribed to the Business of Data platform so that you're the first to receive these podcasts and other various formats of content that we produce, whether it be articles, reports, or our newsletter as well. And do be sure to follow us on social so you're able to interact with other thought leaders like yourself, commenting, sharing, and liking the content as well. Stay safe, look after yourself, and I'll see you on our next show.